How do COVID-19 vaccines work? COVID-19 vaccines help our bodies develop immunity to the virus that causes COVID-19 without us having to get the illness. Different types of vaccines work in different ways to offer protection, but with all types of vaccines, the body is left with a supply of memory T lymphocytes, which are a specific type of white blood cell, as well as B lymphocytes, which are another type of white blood cell, that will remember how to fight that infection in the future. It typically takes a few weeks for the body to produce T lymphocytes and B lymphocytes after vaccination. Therefore, it is possible that a person could be infected with the virus that causes COVID-19 just before or just after vaccination and then get sick because the vaccine did not have enough time to provide protection. Sometimes after vaccination, the process of building immunity can cause symptoms, such as fever. These symptoms are normal and are a sign that the body is building immunity. Most COVID-19 vaccines require more than one shot. All but one of the COVID-19 vaccines that are currently in phase 3 clinical trials in the United States use 2 shots. The first shot starts building protection. A second shot a few weeks later is needed to get the most protection the vaccine has to offer. One vaccine in phase 3 clinical trials needs only 1 shot. What are the risks of the Moderna COVID-19 vaccine? Side effects that have been reported with the Moderna COVID-19 vaccine include injection site reactions, such as pain, tenderness, and swelling of the lymph nodes in the same arm of the injection, swelling or hardness, and redness at the site that the injection was received. General side effects include fatigue, headache, muscle pain, joint pain, chills, nausea and vomiting, and fever. There is a remote chance, which means very little chance, that the Moderna COVID-19 vaccine could cause a severe allergic reaction. A severe allergic reaction would usually occur within a few minutes to 1 hour after getting a dose of the Moderna COVID-19 vaccine. For this reason, your vaccination provider may ask you to stay at the place where you receive your vaccine for monitoring after vaccination. Signs of a severe allergic reaction can include difficulty breathing, swelling of your face and throat, a fast heartbeat, a bad rash all over your body, dizziness, and weakness. These may not be all the possible side effects of the Moderna COVID-19 vaccine. Serious and unexpected side effects may occur. The Moderna COVID-19 vaccine is still being studied in clinical trials. What should I do about side effects? If you experience a severe allergic reaction, call 911 or go to the nearest hospital. Call the vaccination provider or your healthcare provider if you have any side effects that bother you or do not go away. You may also be given an option to enroll in vSafe. vSafe is a new voluntary smartphone-based tool that uses text messaging and web surveys to check in with people who have been vaccinated to identify potential side effects after COVID-19 vaccination. vSafe asks questions that help CDC monitor the safety of COVID-19 vaccines. vSafe also provides second dose reminders if needed and live telephone follow-up by CDC if participants report a significant health impact following COVID-19 vaccination. For more information on how to sign up, visit www.cdc.gov/vSafe. Keep your vaccination card. Keep your vaccination card. When you receive your first dose, you will get a vaccination card to show you when to return for your second dose of the Moderna COVID-19 vaccine. Remember to bring your card when you return. Can a COVID-19 vaccine make me sick with COVID-19? No. None of the authorized and recommended COVID-19 vaccines or COVID-19 vaccines currently in development in the United States contain the live virus that causes COVID-19. This means that a COVID-19 vaccine cannot make you sick with COVID-19. There are several different types of vaccines in development. All of them teach our immune systems how to recognize and fight the virus that causes COVID-19. Sometimes this process can cause symptoms, such as fever. These symptoms are normal and are a sign that the body is building protection against the virus that causes COVID-19. Learn more about how COVID-19 vaccines work with this link. It typically takes a few weeks for the body to build immunity, which is protection against the virus that causes COVID-19, after vaccination. That means it is possible a person could be infected with the virus that causes COVID-19 just before or just after vaccination and still get sick. This is because the vaccine has not had enough time to provide protection. After getting a COVID-19 vaccine, will I test positive for COVID-19 on a viral test? No. Neither the recently authorized and recommended vaccines nor the other COVID-19 vaccines currently in clinical trials in the United States can cause you to test positive on viral tests, which are used to see if you have a current infection of COVID-19. If your body develops an immune response, which is the goal of vaccination, there is a possibility you may test positive on some antibody tests. Antibody tests indicate that you had a previous infection and that you may have some level of protection against the virus. Experts are currently looking at how COVID-19 vaccination may affect antibody testing results. If I have already had COVID-19 and recovered, do I still need to get vaccinated with a COVID-19 vaccine? Yes. Due to the severe health risks associated with COVID-19 and the fact that reinfection with COVID-19 is possible, vaccines should be offered to you regardless of whether you already had COVID-19 infection. CDC is providing recommendations to federal, state, and local governments about who should be vaccinated first. At this time, experts do not know how long someone is protected from getting sick again after recovering from COVID-19. The immunity somebody gains from having an infection, called natural immunity, varies from person to person. Some early evidence suggests natural immunity may not last very long. We do not know how long immunity produced by vaccination lasts until we have more data on how well the vaccines work. Both natural immunity and vaccine-induced immunity are important aspects of COVID-19 that experts are trying to learn more about, and CDC will keep the public informed as new evidence becomes available. Will a COVID vaccination protect me from getting sick with COVID-19? Yes. COVID-19 vaccination works by teaching your immune system how to recognize and fight the virus that causes COVID-19, and this protects you from getting sick with COVID-19. Being protected from getting sick is important because even though many people with COVID-19 may have only a mild illness, others may get a severe illness, have long-term health effects, or even die. There is no way how to know COVID-19 will affect you, even if you don't have an increased risk of developing severe complications. Will a COVID-19 vaccine alter my DNA? No. COVID-19 mRNA vaccines do not change or interact with your DNA in any way. Messenger RNA vaccines, also called mRNA vaccines, are the first COVID-19 vaccines authorized for use in the United States. mRNA vaccines teach our cells how to make a protein that triggers an immune response. The mRNA from a COVID-19 vaccine never enters the nucleus of the cell, which is where our DNA is kept. This means the mRNA cannot affect or interact with our DNA in any way. Instead, COVID-19 mRNA vaccines work with the body's natural defenses to safely develop immunity to disease. At the end of the process, our bodies have to learn how to protect against future infection. That immune response and making antibodies is what protects us from getting infected if the real virus enters our body. The bottom line: Getting vaccinated is one of the many steps you can take to protect yourself and others from COVID-19. Protection from COVID-19 is critically important because for some people, it can cause severe illness or death. Stopping a pandemic requires using all the tools available. Vaccines work with your immune system so your body will be ready to fight the virus if you are exposed. Other steps, like masks and social distancing, help reduce your chance of being exposed to the virus or spreading it to others. Together, COVID-19 vaccination and following CDC recommendations to protect yourself and others will offer the best protection from COVID-19.